Hello, I'm Lisa Jordan. I work for the Persistent Physical Symptoms Service and I'm a specialist physiotherapist. In this video we're going to look at the breath. We're going to focus on observing the breath and also look at some breath expansion exercises. So I just want to ask you now, have you ever thought about your breath or observed your breath? Do you notice how your breath might change, how it alters when you experience persistent pain, for example, or unhelpful thoughts? Or whether you have uncomfortable feelings or are in certain situations, do you ever notice your breath change? So when we have reduced mobility and persistent pain, our breath can become shallower. If we have thoughts that make us feel emotional or anxious or stressed, this can also affect the depth and rate in which we breathe. How about a situation that makes you feel uncomfortable, such as going to the dentist or having an important interview? Along with physical sensations such as increased heart rate, sweaty palms, even thoughts and feelings, our breath will change. In the short term, this is okay, and it's a normal response for our body. However, if we experience and continue to experience persistent pain and or reduced mobility, our breathing can get shallow for longer. It becomes a learned response. This results in reduced oxygen and important nutrients that feed our tissues and also our brain. This is due to actually not using our lungs fully. So when we're breathing shallow, we tend to breathe much higher up, whereas our lungs actually go all the way down to the base of our rib cage. And by taking the oxygen all the way down to our rib cage will help us to then feed our tissues with nutrients, oxygen, and will also feed our organs and will also help to feed our brain. So let's just focus first of all then on taking our attention to our breath. So at this stage we're not trying to change anything, we're just observing. We're just observing our normal breath. So I invite you to come into a nice comfortable position. So a comfortable seated position for you. Feet flat on the ground ideally, and just relax your shoulders down. Just make sure you feel comfortable and supported in your chair. So to begin with, we're just going to notice the rise and fall of our chest or our stomach. Just noticing how, as you breathe in, it expands your lungs. Just notice that kind of swelling sensation as you're breathing in, and then notice that breath out. Close your eyes as well if you wish to. Just taking your attention to your in-breath and your out-breath. Just focusing on the innate quality of your breath. Just noticing how it feels. Now I want you to separate your in-breath and your out-breath, and I want you to observe them individually. So as you breathe in, you just want you to notice the feelings or sensations you might get when you breathe in. So when we breathe in, we're taking oxygen into our lungs. So it should feel quite stimulating, quite energizing as you breathe in. And then notice your out-breath. Do you notice maybe how it feels more grounding? How you tend to sit back into the chair a little bit more as your muscles relax as you breathe out? you might find you feel a bit of ease in the system as well as you breathe out, a bit of grounding into the chair. So just acknowledging the difference between your in-breath and the difference between your out-breath. Just noticing and doing this as an exercise, even if you don't change your breathing, can really help to bring you into a calm state. So just literally not changing anything, just observing your breath and being mindful of your breathing. It's a really good place to start. Now just notice where you're breathing from. Are you breathing from your upper chest, around near your collarbones, your sternum? Or do you breathe lower down, the base of your ribs and near your belly? So just observing where you're breathing from. Again, at this stage, we're not trying to change anything, we're just noticing our breath. And then acknowledging your depth of your breath. So do you breathe quite shallow? Or do you breathe quite deeply? When we close our eyes, sometimes it can be quite hard to anchor yourself to your breathing. One good thing to do is, if you're struggling where your mind starts to wander, our minds do have a tendency to want to wander off into the future or into the past, what you can do is maybe start to count your breathing to help to ground you that little bit more. And that's a nice way as well of noticing the difference between your inhalation and your exhalation. So if you count how many seconds it takes to breathe in, for example, 1, 2, 3, and then how many seconds it takes to breathe out. You'll notice quite often the out breath is that little bit longer than the in breath. So that not only again builds awareness of your in breath and out breath, but it helps to just ground you into the moment a little bit more. And then once you start to practice that and you get used to doing that, you can start to take away the counting side of it. So just open your eyes and come back into the room. And so that's an example of breath awareness. That's a really nice way of just checking in and just observing your breath. We're now going to move on to breath expansion. And if you don't feel ready to do this yet, that's absolutely fine. You might want to practice the breath awareness a little bit longer. But I'm going to demonstrate the breath expansion. And this is where obviously feeds into what I was saying earlier about if we reduce mobility because of pain or because of any other persistent symptoms, often that then stops the oxygen from getting into all of our tissues. And then what happens is the tissues aren't given the right nutrients and oxygen, and then it can make that mobility even harder, which then we start to get into that little bit of a loop, don't we? So with breath expansion, what we're going to do is we're going to place our hands onto the base of our ribs. So again, I would definitely recommend to be nice and comfortable in your chair, supported, okay, feet flat on the ground, and just place your hands onto your ribs. So we're placing ideally the middle fingers together, and this creates a nice bit of feedback for you when you're actually thinking about where you're breathing from. So again, just nice, relaxed, and with your shoulders as well. Just keep your shoulders relaxed and down as well, okay? Not bringing our shoulders up to our ears at all. So from this position, we're going to take a gently breathing in through our nose, okay? So we're going to try and direct that breath now to where you feel your hands. Okay, so breathe in, and you should notice, or can you see whether your fingers separate or not? If they don't separate, it's probably still that you're breathing from high up. And again, don't worry about this, it can take some practice, but just keep persevering. So again, breathe in, and then breathe out. So at the moment we're just focusing on the in-breath, so really just having that awareness. Again, if you need to close your eyes as well to help you, to feel that connection, have your fingertips connected, those middle fingers first of all, and then drive that air down as far as you can, so you're pushing against your hands. And then breathe out, again either through your nose or through your mouth. You should notice those fingertips start to separate as you breathe in, and then connect again as you breathe out. So just noticing, letting the air go through your nose or mouth, and notice your fingertips separate and come back together again. So I'd recommend practicing this 3 or 4 times. Just notice how your ribs come out and expand, how your lungs swell up, how the air enters into the lower section of your lungs. There should be minimal movement around the shoulders as well. Okay, so keeping those shoulders nice and long, nice and lengthened in the neck, shoulders are back and down. We're just focusing on trying to get that oxygen down into the base of our lungs. And if you are struggling with pain, just noticing that pain and just trying to nudge into that pain a little bit as well, just acknowledging it's there, but just continuing to work on your breath. And like I'm doing, after a while, you might find it more comfortable to place your hands on top of each other, because you can feel that pressure through your hands, and then eventually just resting your hands down when you feel you've managed to get that regular breath into the base of your ribs. And you can do that in the morning, so when you first get out of bed, 3 or 4 times, have some nice deep breathing exercises to help to get you up. You could even try your breath awareness first beforehand. If you've been sitting in a chair as well for a little while, again, 3 or 4 deep breaths, and then the oxygen will be delivered to the tissues, nutrients delivered to the tissues, which helps with much more, increased mobility, ease of mobility as well. And yeah, anytime you feel that you've been quite static, just have a go at doing these exercises. Okay, thank you for your time.